Okay, Dr. Rapich here from Vet Triage. We are continuing on with this issue of JAVMA from June 1st, 2015. We're going to be talking about gait analysis in dogs, the influence of leash, side, and handlers on pressure mat analysis of gait characteristics in small breed dogs. This study comes out of the Western University Vet School in California. The objective is to characterize the gait of small breed dogs walked on a pressure walkway by handlers moving at a metronome set tempo, and to determine the influence of handler and leash side on gait characteristics. So right away, small breed dogs can be difficult with gait analysis because they're lower to the ground, they walk quicker, shorter stride, all that stuff compared to big dogs. But also small breed dogs are not as likely overall to develop the orthopedic conditions that like a larger dog would. Obviously, that's a gross generalization, but just to be skeptical about studies, it's interesting that they pick small breed dogs, and it may be that we are missing abnormalities with regard to orthopedic disease in small breed dogs because they are harder to evaluate, and therefore a gait analysis study like this is useful. But just keep that in mind. It's a prospective study, which is good. 5 healthy adult small breed dogs were used, weighing less than 11.4 kilograms or 25 pounds. So again, 5 animals. I mean, it's a very low number. I don't know what the magic number would be, but you want more. The more animals you can have in a study, the better. And for those of you who watch this channel all the time, know that that's a constant problem with these studies. Not enough participants. Procedures. The metronome set tempo was 100 beats per minute. The velocity, cadence, stance time, number of activated sensors, total pressure index, left or right hind reach, and symmetry indices were obtained with the leash on the left and right sides of each dog for each handler. Results: the coefficients of variation for the total pressure index and stance time approximated 30%, whereas coefficients of variation for symmetry indices remained less than 20%. Changing the handler and the leash side did not influence hind limb variables. Changing handlers influenced the total pressure index of the forelimbs, inducing changes up to 8%. The leash side accounted for 12% and 14% of the variation in symmetry indices of the total pressure index and the number of sensors activated between forelimbs, respectively. The mean alterations for record variables was 9%. Conclusion and clinical relevance. Symmetry indices appear to vary less than variables obtained for individual dog limbs, and it may therefore be advantageous to determine those indices during large trials. Handlers or leash side may be changed in studies focusing on dogs' hind limbs without affecting results. The use of symmetry indices is recommended in forelimb studies with multiple handlers. Pressure walkway analyses of the forelimbs should include equal distribution of left and right-sided leash-led trials, given that small breed dogs tend to shift weight toward the forelimb opposite the leash. All right, introduction. The use of force platforms has been found to be accurate for evaluation of limb function in dogs and monitoring changes in force due to disease or treatment. Studies have documented the impact of factors inducing inherent variations in ground reaction forces, such as trial repetition, size of the dog, velocity, acceleration, handler. Therefore, ground reaction forces are typically measured with a single force platform with standardization of handler velocity and dog size. At low to moderate speeds, dogs tend to maintain more than 1 foot in contact with the ground, resulting in overlap of feet on the force platform. Multiple passes are required to collect valid data for multiple footfalls of 1 foot or obtain measurements for multiple limbs. Therefore, kinetic studies dealing with symmetry indices or compensatory mechanisms rely on the assumption that consecutive strides are identical. Moreover, stride length constraints complicate data acquisition for small dogs. Treadmills instrumented with force platforms have recently been used for continuous measurements of ground reaction forces generated by all limbs of dogs during consecutive foot strikes. The main advantages of this method, compared with over-ground studies, are the limited space required and the ability to control the dog's speed to reduce variability in measurements. The pressure walkway systems have pressure sensing walkways that do not measure medial, lateral, or craniocaudal force directions during locomotion, but they allow simultaneous recordings of data for all limbs of dogs of various sizes over consecutive foot strikes during a single pass. They also measure actual foot velocity without photoelectric cells, static weight distribution, and distribution of forces across canine foot pads. And you can see here a picture of what they used in this study. This longer gray one is the pressure walkway for dog pressure mat, and it was placed over a human walkway here, which is smaller. Materials and methods: 5 healthy adult small breed dogs, less than 11.4 kilograms or 25 pounds, no history of lameness. These dogs are used to being on a leash. Body condition score 4 to 6 out of 9. No abnormalities for neuro or orthopedic. The equipment was a 4.3 by 1.2 meter human pressure mat, and then the 16 level pressure sensing pad and circuitry between the base layer and top linoleum cover. A camera positioned at the end of the walkway so that digital video files of each pass across the walkway system were automatically linked to the data files recorded with a computer and software. All dogs walked over a 5.8 by 0.6 meter portable canine pressure mat placed over the human one. By walking back and forth on the mat a minimum of 5 times prior to recording, so they got used to the walking, all handlers walked to the beat of a metronome set at 100 beats per minute throughout the study. Each dog was walked on a loose leash by each of the 5 handlers in one session, alternating leash side, meaning the position of leash and handler relative to the dog. For example, the right leash side meant that the handler and the leash were on the right side of the dog. And that was during each pass. A pass was considered valid if the dog walked on the pressure mat with a relaxed, steady gait, without pulling on the leash, and without obvious deviation of the head from midline, and a minimum of 3 sensors were activated for each footprint. Results: the dogs were 2 to 8 years of age. Mean weight was 6.8 kilograms or 14.96 pounds. The handler's mean age of 31.4 years, and the handler height was a mean of 164.8 centimeters. The mean weight mean weight was 66.6 kilograms or 146.53 pounds. All dogs had similar velocities at 1.3 meters per second, mean cadence of 177.6 steps per minute. The coefficient of variations of the total pressure index was over 30% regardless of the limb, but decreased less than 20% when the same variables were expressed as symmetry indices. With regard to influence of leash side, approximately 12% of variation in the total pressure index of the left front to the right front was attributed to leash side. Leash side did not influence hind limbs. Influence of handler: an interaction was detected between handlers and the total pressure index of the right front leg, with up to 8% change in the total pressure index of the right front of the same limb being induced by handlers. There was no significant difference identified for the total pressure index of the left forelimb to right forelimb, of the right hind limb, or the left hind limb to right hind limb, and the stance time of the left hind limb to the stance time of the right hind limb when dogs were walked by different handlers. Discussion: the main findings were that symmetry indices varied less than stride time and the total pressure index of a single limb, that changing handlers may have influenced the total pressure index of a given forelimb but did not impact symmetry indices, and that changing leash side did influence the symmetry indices of the dog's forelimbs but not their hind limbs. So essentially, the what side the leash is on affects the forelimbs, not the hind limbs, and whatever side the leash and the handler are on, there is more weight placed on the opposite forelimb. The coefficient of variation of the total pressure index and stance time on individual forelimbs and hind limbs in all passes obtained in the study, which is 150 per limb, exceeded 30% and 20% respectively. These values corroborated those reported from Labrador Retrievers walked by the same handler with 3 valid passes per dog. In this study, the coefficient of variations decreased to approximately 10% when calculated on the basis of 3 valid passes obtained with the same handler and same leash side, representing inter-trial variation inherent to individual dogs. This degree of variation was similar to that observed in 21 clinically normal dogs that were less than 46 inches in height, based on 3 valid passes per dog with the same handler in another study. On the basis of this study, the variability of the total pressure index and the stance time for individual limbs seem to be influenced by the number of passes obtained per dog or number of dogs tested. In contrast, symmetry indices varied by approximately 10% under standardized conditions, but their coefficient of variation remained less than 20% when all passes, which is 150 per limb, were included in the analysis. The results confirm that handlers maintain a motion cadence similar to the metronome rate and that this approach was effective in controlling the velocity of dogs. The only influence of handlers detected in the present study was the effect of the total pressure index of the forelimb. A significant difference amongst handlers was identified, with a magnitude of handler-induced variation reaching up to 8% in a given dog. This threshold implies that depending on the trial, the gait of an individual dog may be falsely considered as altered when in fact the variation reflects a change in handler. These findings differ from that reported by another study where the authors concluded that multiple handlers could be included without appreciable influence. In that study, handlers contributed 0% to 7% of the variance observed, which is similar to 1.7% of variance in this study. In contrast, none of the symmetry indices were significantly influenced by the handlers in this study. Leash side contributed to approximately 14% and 12% of the variation in symmetry indices of total pressure index and number of activated sensors, which was representative of the area in contact with the paw between the forelimbs respectively. The changes observed were consistent with a shift in weight toward the forelimb opposite the leash, despite a lack of visual evidence of tension on the leash. The magnitude of the difference between symmetry indices of the total pressure index and number of activated sensors collected from the forelimbs with the leash in the left versus the right was 9%. This value was considered as clinically relevant based on other studies. Data collected for hind limbs were not influenced by handlers or leash side. This study therefore revealed that small breed dogs tend to shift weight toward the forelimb opposite the leash, thereby inducing changes in symmetry in forelimbs. Studies focusing on the forelimb should aim for equal distribution of left and right side leash and include variables obtained for individual dog limbs. So a good study overall, other than the low number of animals. I will say then for vets who are watching this that be aware of this. It may be worthwhile, even though you're not performing let's say official gait analysis in your practice. You at least recognize that walking the dog with the leash on the left versus the right side is changing their gait, how they shift their weight in the forelimbs. And then for pet owners, especially if you have a complicated case that your vet can't seem to really figure out or whatever it may be, and they refer you to specialty, perhaps it's worth inquiring about whether or not the specialty center has gait analysis, because this is the point of studies like this, is to get more finesse in assessing a small breed dog's gait. And of course, these are normal dogs. We of course want to see another study with abnormal dogs where they have neurologic or orthopedic conditions. All right, guys, we'll see you again tomorrow. Thanks so much.